Welcome to Muslims and Mental Health with Sister Heather, a groundbreaking program looking at mental health issues through the biopsychosocial spiritual paradigm.
Welcome to another episode of Muslims and Mental Health. Today we're going to be discussing traumatic brain injury awareness, as September is the month for awareness around traumatic brain injury. I'm going to be joined today by Dr. Omar Mahmood. Some of you may remember him from a previous episode. He's a neuropsychologist specializing in psychological assessment of children and adults. So to open this segment, though, I would like to just give you a few facts about traumatic brain injury. Traumatic brain injury, otherwise known as TBI, is a complex injury with a broad spectrum of symptoms and disabilities. The impact on a person and their family can be quite devastating. Of the 1.7 million who sustain TBI in the United States, 52,000 die, 275,000 are hospitalized, and 1.365 million are treated and released from ERs. The number of people with TBI who are not seen in an emergency department or who receive no care is unknown. So there's still a lot of ambiguity about these numbers, but this is what we know to date. So please join me in welcoming Dr. Omar. And I'd like to start, Dr. Omar, by asking you about what traumatic brain injury is.
Okay, well, traumatic brain injury is a term that can encompass many different ways in which the injury takes place, but in its most basic sense, it's an injury to the brain that results from usually some sort of impact, something that either jolts the person or their head, or shakes them in some way, or they get collided with something else, or in cases like in a war situation, an explosion can cause a blast wave of pressurized air to pass through the person, and that is another way in which the brain is traumatized physically. So it's any of these injuries in which the brain is hurt in some way by some kind of impact or some traumatic event that shakes the brain in some way.
Wow, so that was something new for me to hear about the blast part. Mm-hmm. So how does that, is it just the pressure shakes the brain, or
yeah? So I used to work in the VA hospital, in the Veterans Hospital, and we would see a lot of these guys coming back from war situations where if there was an explosion nearby, usually they would get thrown back, and so the pressure of that wave of air and the blast itself pushes them, but it also kind of rocks them, and their head can suffer trauma from that type of event.
Wow. Okay. So, and I think another familiar traumatic brain injury that people might be familiar with, I'm assuming that includes like concussions when people are playing football, for example. We've heard a lot of these cases in recent years.
Sure.
Where teens are getting injured or...
Yeah, and the thing is that there are different levels of traumatic brain injury. You can have a very mild one, or a moderate one, or a very severe one. And a concussion is usually a term associated with a mild traumatic brain injury because it usually involves some hit to the head, like in sports or a car accident or something, but the person doesn't necessarily have obvious injury to the outside viewer. It's not like there's a major gash or dent in their head or something. It's just they might have been dazed for a moment, or had some confusion or blurry vision. So a concussion is thought to be more mild, but it still isn't. It can be an injury that has effects, but the mild, moderate, and severe, it kind of depends on different symptoms and the way in which the brain was injured in that moment. So,
So I'm kind of curious because it sounds like there's a whole spectrum of ways you can get TBI. Mm-hmm. But for some of the parents watching who have children in soccer, for example, should they be worried about, like, that soccer ball when they hit their head on the, I don't know what you call it, but
Yeah.
that move? Is that something to be concerned about?
That's a great question, actually. That's something that researchers are very interested in. We know for more heavy sports, like things like football, for example, there's increasing evidence that it can, put you at a higher risk for a traumatic brain injury. There's a number of, high school, college, professional football players, when they have these tackles and these impacts where their helmets collide or they collide with the ground, and there's a number of people who get knocked out sometimes for a short period of time. They lose consciousness. These are clear and real injuries, and the danger is definitely there. And so, even the idea of what type of helmets they can wear, how to reduce the injury in a sport like football, there's a lot of discussion about that. Soccer is thought to be less of a contact sport, but you're right. You do get these headers where you hit the ball,
okay, that's what it's called.
and it might be purposeful or might be accidental. It could just hit you from the side without you looking. And although that's not as powerful as a hit in football, the thought is, what if you're exposed to many of these over a course of years playing soccer? And so there is some, anecdotally, some people have, the belief that it over time it can compound the effects and could be dangerous as well. But right now we don't know what is the impact of a single header to the head. Generally speaking, it may be okay, but I think it's the long-term exposure that's the question.
Wow. Okay. And so, what are some of the symptoms that people would look for if they thought there might be a brain injury?
Sure. So in the most severe cases, I'll start with the severe and get more mild. In the most severe cases, there's usually other evidence of a major injury, right? Bodily harm has been damaged in some way, or there's an obvious, injury or indentation to the head or something very serious. And in those situations, it's pretty clear it's been a severe injury. In the moderate and mild cases, one of the signs that is a sign of a more severe or a more serious injury is a loss of consciousness. So somebody just completely is out and they're not aware of what's happening for some period of time. And there can also be some dizziness, there can be blurred vision, there can be ringing in the ears. These are all symptoms that immediately can be perceived right after the injury. And then there's some, later on, there can be some cognitive symptoms as well, like memory loss. It's pretty typical in a serious brain injury for the person to not even remember the event because the brain goes through a period of amnesia where even the events leading up to the injury are sort of wiped out of the memory. And so there's some
sort of protecting itself from the trauma.
Could be, yeah, I think there's a protective effect to that, protecting from the trauma. It's also there, from a memory encoding standpoint, the brain did not get a chance to download those memories per se. It was still in the RAM, you could say. It was still in the short term. An event right before an accident, for example, you didn't get a chance necessarily to store them in your long-term memory yet. So once you got injured, some of that information is lost. But it also does, some people have been involved in such serious accidents, and when they think about it later after recovering, they're kind of glad that they didn't remember it because it could be really psychologically traumatic.
And so I'm wondering so these are for the people who have communication skills, but how would you know the symptoms? For example, we've heard over the years about babies who are shaken. How would you know those symptoms? Yeah,
so it would require the parent, usually the parent or someone that's caring for the baby would be able to observe some noticeable changes in the baby's behavior or the young child. It could be over somnolence, like very drowsy and sleepy all the time. It could be sort of another, red flag is sort of random nausea or even vomiting, when there wasn't any apparent cause for it. There could be other sort of agitation in behavior, sensitivity to light and sounds and things like that. So there's more of a behavioral observation that has to be made, and is it a stark change from how the child used to be? But then they also might have similar, child version of symptoms that you would see in adults as well, like, signs that their vision is maybe not accurate, or they're confused of where they are or what's happening around them.
So that's a good lead into the next question I want to ask you, which are, what are some of the effects of these injuries?
Yeah, I mean, initially...
Because it sounds almost like you're signaling a little bit that it could like change your personality even.
A very serious traumatic... Well, of course, I'll go again through the severity levels. In the most severe cases, unfortunately, the effects could be quite devastating. I mean, as you mentioned in your statistics, some people just don't survive after a short period of time. They struggle, and then they can't pull through. Mm-hmm. Others who do survive but with a very severe injury, they may never fully recover many abilities that they used to have, whether it could be language, it could be their visual spatial abilities, it could be their decision-making abilities, or their ability to remember new information. Like the previous information may be okay from earlier in their life, but new information may be difficult for them to store and encode.
So they'd have problems with their short-term memory then?
They'd have problems transferring information from their short-term memory to their long-term memory. Yeah, it would just kind of live in short-term memory for a brief moment and then be rapidly forgotten.
Wow.
You can also have sleep disturbance. That's a major result, in terms of how it can affect your life. You can have just other psychological conditions. Depression, anxiety can be common after that. One of the main reasons is because you've noticed all your limitations. It's a weird situation where the mild and moderate brain injured people, people with mild and moderate brain injuries, they may actually perceive their limitations more than someone with a severe injury, because they have more awareness. So someone who's mildly injured, they're acutely aware that I'm not able to do the things I used to do, and this is very frustrating to me. And I wish I could go back to work or go back to my family or do the things I used to do. But someone who's severely injured is actually typically they're in a higher level of care at that point, and they may have they may be in a rehab center or a nursing home for years after that, or the rest of their life, and so they might necessarily perceive that same level of frustration as someone with a mild or moderate injury.
So it occurs to me that it seems like somebody who has maybe a moderate to severe, where they have problems storing information, could be taken advantage of very easily socially.
Yes.
And then not remember it, right?
Yeah. That's actually one of the concerns is, as a neuropsychologist, when we're assessing a patient, I try to see whether or not the patient has the mental capacity to make decisions, medical decisions, financial decisions, and things like that, and whether or not they fully understand the consequences of their choices. And that can be something, like you said, that they'd be vulnerable to other people, manipulating them or taking advantage of them. And so one thing that usually is done in those cases, maybe a social worker is involved, and we try to see if a family member could be designated as a decision maker, or someone else could take conservatorship over the person's affairs, so that there's some protection for them in some way.
Mm-hmm. Okay, so I really want to ask you more about the treatment and a little bit more about causes and things, but right now I need to take a break for our sponsor. So we're going to take a short break for our sponsor, and we'll be right back.
Hi, welcome to Adelante. This is Adelante Recovery, and my name is Yvette Kuglin, and I'm part of the staff.
Adelante Recovery Center has helped people in dual diagnosis for 5 years. We accept most PPO insurances and provide luxury accommodations and 24-hour support. To speak with an admissions counselor, call 1-888-242-4450.
A lot of time we don't even know what's wrong with us, and sometimes we need to get away to figure that out. So if you want to go for a little retreat out in Corona Del Mar, which is a confidential location, we're here to help. So we're only a phone call away. Thank you.
Welcome back to Muslims and Mental Health. Today we're discussing traumatic brain injury, and I'm joined with Dr. Omar Mahmood. Thank you, Dr. Mahmood. I want to continue now and ask you if there was anything else you wanted to mention in terms of the causes of TBI.
Yes. So as you mentioned, some of the most common causes of traumatic brain injury in America is the most popular ones that people hear about are car accidents and sports injuries. In more violent areas, it could, you could consider a gunshot to the head, or traumatic, just a blunt trauma to the head as well as an injury. But all of the causes usually involve some event, and we tend, as neuropsychologists, we tend to look at, what led up to the event, what was the experience of the event, and what are the consequences after. And those are the main causes. There's a number of things that, put you at risk for the injury. And as I mentioned, given the type of injury, it usually has to do with your own demographics. So young people are more prone to take risks and do adventurous things where they could get their head injured. So they're the most at-risk population.
Okay. And I suppose just common sense things like seatbelts and things like that could be helpful and not receiving a traumatic brain.
Yeah. I mean, that's actually a great question because, in the stereotypical sense, in a very dramatic car accident, people are thrown around and they go through the windshield or they hit the dashboard, and there's going to be obvious trauma. But one of the things that happens, of course, is so the brain, if you can imagine my fist is like a brain, it's just floating in the fluid inside your head, which is the cerebrospinal fluid. And so when the head impacts something, the brain then hits in the inside of the skull and bounces around. So it may be damaged in multiple areas. The other thing that can happen in a brain injury is what they call a shearing injury, which is when your head is twisted really quickly in one way or another by some impact. And so the brain twists.
So like a whiplash or a punch or
Yeah, like a severe punch, for example, it could twist the brain. And so there's gray matter and white matter in the brain, and some of those relationships could get a little bit, strained or pulled, because there's white matter tracts in the brain that are all sort of interconnecting parts of the brain. And so when the brain is twisted in that way, you can have an injury also. And it may not necessarily be as obvious as someone who has a big gash on their head because they hit the dashboard. A seatbelt will help, of course, but even with a seatbelt, if the impact is large enough, you could still, because of the whiplash factor and the way that somehow the car moved, you could still sustain an injury in the brain.
Mm-hmm. And I understand another issue there is also swelling, because if the brain swells, it has nowhere to go because of the skull, right?
Correct, yeah. So, I think the science is improving. Every few years they come up with new methods to treat someone with a brain injury right on the scene, so that, or early in the ER, for example, so that they can make sure the swelling is kept under control. So
that's great entree into, how we treat these injuries, because, if we have a swollen muscle, we know how to treat that. With the heat or the cold, right? But with the brain, how would you do that?
Yeah, the brain is still a mystery in many ways, and I don't think we probably know only a fraction about how to treat it or heal it when it's injured, and frankly, a lot of the treatment for people with brain injuries is basically giving them a safe environment where they can be provided the proper nutrition and care and rest, and it's mainly letting the brain heal itself, and trying to prevent further injury from taking place. So if bleeding has started in the brain because of the injury, then usually a neurosurgeon will go in and try to stop that, because blood is not supposed to get on the brain. That causes even more damage. It's interesting that the body's response itself, which is to knock yourself out, to get knocked out when you go into a brain injury or to lose consciousness, that also may have some beneficial effect in terms of the neurobiology, because it kind of shuts down the brain in a way, or puts it into a more a less aroused state, so that
almost like a self-healing.
So that
protectiveness
gives a chance for the brain to kind of heal. And even in some severe cases, doctors will induce a coma to let the person just benefit from that moment, that time to heal. But a lot of it is just waiting. It's just letting time heal. Most mild injuries that are mild brain injuries in which there wasn't a significant loss of consciousness, there wasn't significant memory loss. It just kind of, the person may have been dazed for a moment. Those types of injuries, the research has shown that most of the symptoms, if not all the symptoms, will go away within 6 months to 18 months. Sometimes sooner, depending on how mild it was. So that's just shows the power of time.
So along the lines of treatment, when just so we can sort of educate clients and patients, what are some of the assessments they could expect to hear? I'm going to do this type of assessment for, assessing for TBI, so that they feel, empowered when they go to see the doctor.
Sure. Yeah. So if somebody, again, it's going to depend on the severity of what they experienced, but if a brain injury is suspected, there's a few different assessments that are usually done. One of the most simple ones is just quickly checking the person's basic cognitive abilities. For example, do they know where they are? Are they well oriented to the time and date? Do they know their name? Can they explain what happened? Do they have some memory of what happened? Are they responding to different commands and things like that? So many paramedics will do that right on the scene. They'll check the person at the scene of a car accident. Can they answer these basic questions? Can they follow some simple commands? And that gives you it's just a very rough, obviously, assessment, but it kind of helps to see the severity of the injury that took place. Then later, if there's still symptoms, like nausea or vomiting or other headaches and dizziness and pain, you might go for some neuroimaging, so to get a CT scan of the brain, or if that is still not very clear, an MRI, which can sometimes provide more detailed pictures of the brain. And that is for the radiologist to look and see if they see any acute damage to the tissue, the brain tissue, within or other parts of the head, or skull, if there's a fracture or something, a small fracture. So that's another assessment. Then after the initial intensity of the injury kind of passes, it's pretty common for, if someone feels like they're still experiencing symptoms of a brain injury, that they might go for a neuropsychological assessment and get completely tested on all of their cognitive abilities, their intellectual functioning, memory, attention, all of these things, just to get a baseline sense of where they're at. And this might be something that is later followed up, a month or 6 months to 12 months later, to see if there's been improvement in that regard.
Yeah, that raises an interesting question in my mind about, I'm just wondering if it's not a good idea for families to have cognitive testing somewhere along the line in the development of their family, because how would you know if they were different
Yeah.
from before
Yeah.
the traumatic incident?
That's a great question. I mean, that's one of our mysteries that we're always struggling with.
Is that something you ever do, like a sort of a preventive or proactive, like let's get a baseline when you're normal and then,
It does happen. I mean, it happens a lot actually in research studies where they'll follow people over a number of years, and sometimes they'll follow people who are at risk for certain things. So they'll start early, get them a baseline evaluation when there is actually nothing necessarily wrong or no incident, and follow them over a period of years and keep bringing them in for testing. And then if these people are at risk for some condition or some event, then see how that plays out afterwards. You'll also find, I think, a lot of professional sports teams. I think they do basic assessments of all their team members, prior to starting any activity, so that they have that comparison point before and after an injury. And maybe some high-level companies do that too. But
I've heard of these things affecting drafts and for certain types of sports before.
Yeah.
Like they look at the injuries of the players before they decide
Yeah.
whether they want to have them or not.
Yeah, so it is, but it's not typical, I would say, in the general population. It's just because it is kind of it could drive up a lot of costs to do that, and there isn't it's not a medical necessity. I guess you couldn't really argue that in the baseline sense, but so it's not typical in the general population.
So I want to switch gears a little bit and ask you. If you know of any particular resources within the Muslim community that can assist people with TBI.
There isn't really something specific to the Muslim community. There's just like any other community or group of individuals or population within the larger population. They have access to all the same resources that anyone else in the society would have. So whether that be after a severe injury, the medical centers and hospitals and clinics like everyone else can go to.
So if it were an immediate, like if there was a car accident, you would probably be going to the ER. I mean, if it were really bad. But for example, if a family got home after a football game or something like that, and there wasn't any immediate sign, then would you still advise them to go to the ER, or would they go to their primary care physician? If something came up later, how would they address that?
I mean, I think it's going to depend on what they see, but if there's some really out of the norm symptoms that start showing up, I probably would say go to the ER.
Like vomiting and
vomiting, or just strange sleep patterns that are for long periods of time, or cognitive issues, like they have some memory loss of what's going on, or they're not being able to focus right away. Those things should be checked out, especially if there was a recent event at the sporting incident or any type of incident. And so then the main reason is they can quickly get screened, in the ER, and if necessary, get a brain scan just to see if something is going on there. But if it's a very mild symptom, like someone's having headaches and they remembered like a couple weeks ago they had some bump or they had some injury, that might not necessarily need to be seen by an ER, because at that point anything severe would have happened already from that injury, and there might be some mild process going on in which they could go see their primary doctor or a neurologist to kind of get an assessment done.
Mm-hmm. And so I kind of want to just distinguish a little bit, again, for awareness and empowerment for our viewers about ERs, right? Because their main focus is really to stabilize, right? And to, like you said, screen. But if you suspect something, it's still good, right, to follow, even if you go to the ER, to follow up after you get released with your primary care.
Oh yeah, I mean, and
or a neurologist or a psychologist.
Exactly, and to seek the follow-up care is really important. I mean, I know a number of people in our communities, they might just go to the ER and then just go home, and like that is really their only contact with a medical professional. And unfortunately, the major benefit of the process is the follow-up situation, where you are getting more detail about your condition. You're getting more specific types of tests done with providers that are specialists in that area. Whereas in the ER, you're being treated by an ER doctor who's trained at seeing a wide spectrum of different conditions and screening for those. But the actual care and recovery is usually better handled by someone who's a specialist in follow-up sessions.
Okay. Great. I think that's really helpful because, like you said, a lot of people think we've gone through the ER and then we're done.
Yeah.
So are there any other considerations for people who think they may have a concern with TBI that you would like to share?
Just like I mentioned, the risk factors, just being aware that, people between, teenagers up to the age of 25 even are one of the highest risk groups. So if you have someone in your family member or you yourself are in that group, just to be aware that your risks are higher than the average person in the population, simply because of the activities or even the activities of your friends, their driving or their decisions that they make, and not to say that you can't have fun. I mean, I'm a snowboarder. I've been a snowboarder since I was a teenager, and there are definite dangers in doing sports like that. But you can, if you have an awareness of what you need to do, what are the safety measures. I think it's great now that helmets are pretty common now. Compared to when I was a kid, they weren't. But even for bike riding now, you see kids wearing helmets, and that's also a good thing. And just being aware of that risk factor.
Speaking of populations, because it just came to my mind that, you're talking about teens, but if we look at the elderly or the senior population, it would seem like it might be kind of hard to distinguish initially. Are we looking at TBI? Are we looking at Alzheimer's? Are we looking at Parkinson's? I mean, you wouldn't really know, right?
Yeah. I mean, if you just see the patient right away, you don't know. That's where getting a history is very important from the other family members, or understanding has there been a progressive nature to this cognitive decline, or is it just something sudden? And neuroimaging would also help in that situation. And you mentioned an important thing, which is the elderly as well. Like, they're also another at-risk group because they do sustain falls more commonly than the average person in the population. So, and they may not necessarily have the same physical dexterity as others, so they might bump into things or sustain injuries more frequently.
So I just want to mention one more group that and ask you about them, which is the family of people who sustain TBIs, because it would seem to me that they might be at risk as well for sort of maybe depression or anxiety or things around the change of the environment of the family, structure when somebody has a traumatic brain injury.
Yes.
And just what would you kind of advise, families to consider when they're a family member of somebody who has TBI for themselves? Oh,
that's a great question, because the injury doesn't just affect the individual, and it can have a sort of ripple effect throughout the whole family. And if it's a very severe injury, that person's role in the family is fundamentally changed, and so everyone else in the family can be fundamentally changed, and some negative consequences could come out of that if they're not aware of it. So making sure that they engage in their own self-care and monitor their own emotional symptoms or stress levels when they're dealing with a family member who has a brain injury, and also being aware of that person's limitations or the difficulties they're having, to be able to show them empathy and to understand that things can escalate really quickly if both parties don't understand each other or what's happening or what they're going through. So there's kind of being aware of that whole dynamic. I think it's always a good measure if someone has sustained actually any major injury, but any brain injury as well, for the family to come in and have a group meeting with, a mental health professional who deals with that patient population. So there are, and that there are psychologists who deal with brain injury. And so they typically, in many of the places that I trained in, for example, when I remember when I was at the Rehabilitation Institute in Michigan, we would always have to have a family session with the patient's family just to talk about symptoms and talk about how they're dealing with the symptoms and any concerns or frustrations they have. Those are really important because if the family is healthy and feeling supported, then they can then provide more support and care to the injured patient.
That's great. Yeah. So, okay, great. Is there anything else you wanted to mention about TBI?
No, just be careful out there.
Okay, so we're going to transition now into a few fun questions. And I know that we had you on before, so I'm not going to ask you the same ones.
Okay.
But I want to ask you what your favorite Muslim organization is and why.
Yeah, that's a good one. I guess since we're, I could choose from so many different organizations, so it's really hard for me to say the number one. But since we're talking about this topic, I think, I think the Ummah Free Clinic, here in Los Angeles is one of the most inspirational to me. I was involved as a volunteer in that clinic when I was in college, and it provides, free health care, health screenings, access to doctors, to patients that are populations that need and don't necessarily have the resources to get that type of help. So and it has actually, the neat thing now is that over the years, it has kind of inspired other similar organizations around the country, different types of free clinics.
Oh, that's great. And what is your favorite concept in Islam and why?
One of my most favorite concepts in Islam is the idea of etiquette and good character, and kind of that even being the central purpose of religion. So that the Prophet ﷺ, he talked about how he was only sent to perfect good character. And so being overly focused on details of, ritual and law, although that's extremely important and needed, that is not necessarily the only goal of the religion. That is a means to get to the goal, which is to perfect one's character. So I like the idea of emphasizing one's etiquette and good character, and the idea that if you are able to show good character, then you're actually benefiting from your religion. And if you're not able to show good character and deal and treat with people with kindness and etiquette, then it's as if you're not really benefiting from the religious knowledge that you have.
And then lastly, your favorite word and why?
My favorite word these days is in Arabic limada, which is why. And I hear that a lot from my children, because when tell them that they have to do a certain thing or they can't do something, they usually ask why, or limada. But then it's also a question I can pose to them when they might ask me a question or something that didn't occur to me, and I'm curious to, like, what brought that up in your mind, and it stimulates a lot of discussion. So currently that's the word.
Well, that's great. It's a sign of good curiosity, right? Okay. Well, thank you so much for joining us. This is really helpful information, and I think that people will really benefit from the raised awareness and knowledge of this episode. So this concludes another episode of Muslims and Mental Health. We are so happy to hear your comments, your concerns, and your feedback. You can reach us at nafshealertherapy@gmail.com, NAFSHEALER therapy@gmail.com. And again, feel free to check out our website as an adjunctive resource at www.nafshealertherapy.wordpress.com. And we look forward to seeing you again. Thank you.